Anti-hepatitis medications are a group of antiviral agents used to treat viral hepatitis, which is the inflammation of the liver caused by some sort of virus that targets and damages liver cells. Now, viral hepatitis can be acute or chronic. Acute hepatitis lasts for 6 months or less, and usually resolves on its own without any antiviral treatment. Chronic hepatitis lasts for more than 6 months, sometimes even for decades. Anti-hepatitis medications are mainly used to treat chronic hepatitis, and the two main viruses are hepatitis B virus, or HBV, and hepatitis C virus, or HCV. Alright, so HCV is a single-stranded RNA virus. What this means is that HCV injects its RNA into the host cell, and it can immediately use its host ribosomes and translate the proteins needed to make more viruses, like capsomere proteins and enzymes like RNA-dependent RNA polymerase. This RNA-dependent RNA polymerase uses the viral RNA as a template, and uses the hepatocyte's nucleotides to transcribe a complementary strand of RNA, which is then used to form new baby viruses. HBV, on the other hand, is a double-stranded DNA virus. Once the DNA gets injected into a new cell, it enters the cell's nucleus and is replicated by the host cell's machinery. It's also transcribed into several messenger RNAs and pre-genomic RNA. And then the messenger RNAs are used to make capsomere proteins and enzymes like DNA polymerase. DNA polymerase uses the pre-genomic RNA to synthesize new copies of the viral DNA, which is combined with the capsomere proteins to assemble new viruses. With each type of virus, whether it's RNA or DNA, it's turning your own cells into virus-making factories and pumping out new viruses. This process strains, damages, and potentially kills the infected hepatocytes. When these liver cells die, the liver gets inflamed, and that's called hepatitis. The anti-hepatitis medications can be divided into two groups based on their mechanism of action: nucleoside or nucleotide analogs, and interferons. Let's start with the nucleoside and nucleotide analogs. This group includes nucleoside analogs like ribavirin, entecavir, and lamivudine. Nucleotide analogs like adefovir, tenofovir, and sofosbuvir. However, entecavir, lamivudine, adefovir, and tenofovir are used to treat HBV infections, and ribavirin and sofosbuvir are used to treat HCV infections. In both types of infected cells, the analogs are first phosphorylated by cellular enzymes into either a diphosphate or triphosphate form. The phosphorylated forms are similar in structure to natural nucleotides present in the cells, so we can think of them as fake nucleotide molecules. Viral enzymes will try to use these fake nucleotide molecules when trying to synthesize new nucleic acid. In the HBV-infected cell, this enzyme is HBV DNA polymerase, while in the HCV-infected cell, the target enzyme is RNA-dependent RNA polymerase. Once these fake nucleotides are incorporated into the growing DNA or RNA, no additional nucleotides can be added, and viral nucleic acid synthesis stops. In addition to this, ribavirin also has another mechanism. Ribavirin is initially phosphorylated to a monophosphate form, which inhibits the enzyme inosine 5-phosphate dehydrogenase. Inosine 5-phosphate dehydrogenase is an enzyme in the host cell, which converts inosine monophosphate into xanthosine monophosphate, which then goes on to make guanine nucleotides. Ribavirin monophosphate resembles inosine monophosphate and binds to its site on the enzyme. This inhibits the inosine 5-phosphate dehydrogenase, reducing the synthesis of guanine nucleotides, which in turn reduces the synthesis of viral mRNA. These nucleoside and nucleotide analogs are given per oral. Adefovir and tenofovir are poorly absorbed when given orally, so adefovir is given in the form of the prodrug, adefovir dipivoxyl, and tenofovir is given in the form of tenofovir disoproxyl. These prodrugs are rapidly absorbed and converted into adefovir and tenofovir, respectively, in the intestinal cells by an esterase enzyme. Eventually, nucleotide and nucleoside analogs are transported out into the blood and carried to the kidneys, where they're excreted via the urine. Ribavirin undergoes another extra step where it's first dephosphorylated by a phosphatase present in the host cell's nucleus. This causes ribavirin to start accumulating within cells which lack a nucleus, like the red blood cells. Now, nucleoside and nucleotide analogs commonly cause side effects like headache, nausea, fatigue, and abdominal pain. In addition, ribavirin can cause hemolytic anemia and hyperuricemia, or increase in uric acid levels due to its accumulation within the red blood cells. Ribavirin can also cause rash, itching, insomnia, cough, and also birth defects when used in pregnant women. Ribavirin increases the efficacy of interferons when used together. It can also interfere with the activity of other medications like HIV nucleoside reverse transcriptase inhibitors like zidovudine. Lamivudine can cause anorexia. Keep in mind that HBV strains often develop resistance to lamivudine due to a mutation in the DNA polymerase enzyme. This can cause the infection to return once the medication is stopped. Next, at higher doses, adefovir can damage the kidneys, which causes proteinuria, or increased protein in the urine, as well as glycosuria, or increased glucose in the urine, and azotemia, or increased nitrogen-containing compounds like urea and creatinine in the blood. The next group of anti-hepatitis medications are the interferons. Interferons are cytokines, or signaling proteins, produced by virus-infected cells and cancer cells in the body, as a warning sign for the other healthy cells. As their name implies, they interfere with processes like viral replication. There are two types of interferons, type 1 and type 2. Type 1 interferons include interferon alpha and interferon beta. When surrounding hepatocytes detect these type 1 interferons, an alarm is raised, and they try to protect themselves by synthesizing proteins that degrade mRNA. This blocks viruses from rapidly making copies of themselves, inhibit protein synthesis, which blocks viral proteins from being produced, and they increase expression of MHC molecules, which makes it easier for cytotoxic CD8 positive T cells and natural killer cells to do surveillance and kill them if they're infected. Now, the only type 2 interferon is interferon gamma. Like the type 1 interferons, interferon gamma also promotes an antiviral state, but it also helps activate macrophages and CD4 positive helper T cells, which then secrete their own interferon gamma and interleukin 2. In order to be used as a medication, interferons are artificially synthesized using recombinant DNA technology. Interferons are either given as intramuscular or subcutaneous injection, which is typically given 3 times a week. Sometimes interferons can be given in the form of pegylated interferon, which is interferon plus polyethylene glycol. For example, pegylated interferon alpha, or PEG-INF alpha. Pegylated interferons are absorbed more slowly than plain interferons, so they require less frequent dosing of about once per week, and also cause fewer side effects. Currently, only 2 types of interferons, interferon alpha-2A and interferon alpha-2B, are available for clinical use. Interferon alpha-2A has a longer half-life than interferon alpha-2B, meaning it stays in the blood longer. Interferons are used in the treatment of both chronic HBV and chronic HCV infections. Interferon alpha-2A or interferon alpha-2B, or their pegylated forms, are used to treat chronic HCV infections either alone or in combination with other antiviral medications like ribavirin. They're also used in the treatment of chronic HBV infection. In addition, interferons are also used in the treatment of herpes virus infection, papillomavirus infection, and Kaposi sarcoma occurring in HIV infections. Side effects of interferon alpha include flu-like symptoms like fever, malaise, nausea, and vomiting, bone marrow suppression leading to neutropenia and thrombocytopenia, neurotoxicity leading to sleepiness, depression, and behavioral disturbance, and liver dysfunction leading to elevated liver enzymes. It can also cause alopecia, which is more common in children. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharmacology facts. Since we're talking about liver damage, let's go to a bar during the Prohibition era. Understandably, this bar is not busy, and we have a bartender representing hepatitis B, standing at one end, and his only customer, representing hepatitis C, at the other end. Now this bar is disguised as a pet shop to fool the cops, so let's put some animals in here to represent the nucleotide and nucleoside analogs. By the bartender, we have entecavir, an anteater, lamivudine, a lamb, adefovir, an aardvark, and tenofovir, a tentacled octopus. These medications treat HBV infection. So by the customer representing HCV infection, we have ribavirin, an angry rhino, and sofosbuvir, a leather sofa that used to be a cow. For side effects, ribavirin can cause hemolytic anemia, so let's impale a large red blood cell on the horn of the rhino. It's also contraindicated during pregnancy, so let's have an angry pregnant lady riding on its back. Adefovir causes renal damage, so let's have an aardvark eating a tasty kidney that someone left on the ground. Now, 2 police officers busted into this bar to interfere with the good times. And they have the letters A and B on their uniform for interferon alpha 2A and 2B. They're standing directly between the bartender / pet shop owner and the customer, since they can treat both types of viral hepatitis. For their side effects, one of them is holding a bone like a club for bone marrow suppression, while the other is holding a damaged liver he found while looking for evidence. If we look at the heads of the 2 officers, one is bald for alopecia, while the other has his brains showing to help you remember interferons can cause neurotoxicity. The most common side effect is flu-like symptoms, so let's give them both runny noses and thermometers in their mouths. Alright, as a quick recap. Anti-hepatitis medications refer to a group of antivirals used in the treatment of viral hepatitis. They can be divided into 2 groups. The first is nucleoside or nucleotide analogs. Ribavirin and sofosbuvir inhibits HCV RNA-dependent RNA polymerase. Ribavirin also inhibits inosine 5-phosphate dehydrogenase, which decreases synthesis of guanine nucleotides. Entecavir, lamivudine, adefovir, and tenofovir inhibit HBV DNA polymerase and are used to treat chronic HBV infection. Next, we have the interferons like interferon alpha 2A and interferon alpha 2B, which stimulate the body's cells to synthesize proteins that degrade viral RNA, and also surface proteins that alert immune cells like natural killer cells. But wait, there's more. Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember, and stay tuned for the answers after the credits.